You mentioned there to wait 20, 30 minutes if we're going to brush our teeth after having something, higher in carbohydrate. Talk about the physiology there and the specifics of why that is.
It's important to know this because the short answer that dentists have been giving for a long time is brush your teeth. You can eat whatever you want, just brush your teeth. Well, it turns out that when the pH is very low, let's say you've consumed something that is acidic in nature. Some mineral waters are low in pH. Coffee is low in pH. Alcoholic drinks are low in pH. A lot of these sports beverages, even and I just discovered this recently. These electrolyte drinks. There was one that was a sponsor of my podcast, and the pH was 2.4. Very well known electrolyte company, and I'm not recommending electrolytes. I think they're good, but there are a lot of things that have a low pH. So if you're consuming them, you're at work, you're sipping a Diet Coke, even that's high in acid, even though it doesn't have sugar in it. That frequency is lowering the pH in your mouth. And then there's another pH moment that is compounded by ingesting acidic beverages and foods. And that is a food that creates an acidic event. And we talked about that, the goldfish. So you're fermenting a snack, a carbohydrate, and the bacteria consume that readily fermentable and digestible product because it's been processed and broken down. And then they produce an acid. Their metabolism produces a byproduct, and that is a highly acidic product. And so you're lowering the pH just by eating a cracker, which doesn't really have a pH per se. So usually we're consuming the acidic beverage with the acid producing snack. And if you do it a lot during the day, or if you do it for long periods of time, you're just sitting there snacking over an hour, working on a document at work, that is just too much for the body. In other words, it cannot handle that state of demineralization. So if you were to brush in that period of time, let's say you've had your 30 minutes of snacking and you want to be a good patient, and you're doing what your patient or your dentist or your hygienist told you to do, and that is to brush after you eat something that you shouldn't have eaten, that is likely a mistake, because in that acidic environment, if you're anything under a pH of 5.5, if you go in there with some nylon bristles, even a high quality toothbrush, a mildly abrasive toothpaste, most toothpastes are abrasive, that's how they work. It's kind of like dishwasher detergent. That's how it works. It's not just soap and emulsifiers. It's a little bit of a abrasive powder that gets squirted around to scrape your dishes. Same concept. You literally are brushing your tooth at its most vulnerable state, and that is in a state of flux where it's releasing calcium ions. It's releasing the actual components of its structure: hydroxyapatite, which is calcium, phosphate, and hydrogen ions, but essentially calcium. Now, if you were to wait until the body has come back to a normal pH, a neutral pH, and in doing so, it's trying to remineralize those teeth. There's a system in place to take all that lost calcium and to put it back in. Then that is the best time to brush. And so I think we've been giving the wrong message for a long time in the profession, but it's catching on now. Wait 30 minutes. This is after a cup of coffee. A lot of people will brush right after coffee because they think there's some residual stain, or coffee, the tannins in wine, tea and wine. They think if they brush right afterwards that they are removing those stains. In fact, they're not. And secondarily, they are scraping away healthy, good tooth structure. And that's why a lot of people that do that have sensitive teeth. They have very porous teeth. The root structure is porous. And when they ingest something like some cold water or ice cream, they cringe. So you got to give it 30 minutes. Now, you can hasten that process. You could swish with water. You can chew xylitol gum. There are lozenges. There are pH balancing lozenges and pastules that you can put in your mouth. And if you can bring that pH up, and there are ways to measure pH to figure out how long that takes in your mouth based on the snack you ate, then you can brush at that point. It's a safe time to brush. But I would argue that if you're at work, you had a snack and you chew xylitol gum, and you know how much xylitol there is in there. You want 2 to 4 grams of xylitol in each piece of gum. You chew it for a few minutes, swish with some water. You should be fine. You shouldn't have to brush in 30 minutes. So that 30-minute kind of threshold is very important.
Earlier, you talked about the fact that recently you noticed the electrolyte you're recommending and using was dropping the pH. This ties into the hydration piece you just brought up. What have you done in that realm? Is it just being more conscious of when you're using that, changing brands? Talk more about that piece.
No, I'm glad you brought that up. I changed brands. It was interesting. A wonderful company. I'm not going to mention their name. And big seller. Interesting ratio of magnesium to the other electrolytes, minerals. But the pH, they add citric acid to these electrolyte powders, and the pH. So I have a $500 pH meter. I measure pH of everything that goes into my patients' mouths, and toothpaste, of course, and mouthwashes and foods, and it has to be calibrated, and it's a big deal. So when I do that, I have a whole bunch of things out on the counter. And so I noticed I was using the product and I was enjoying it, and we had invested in the product. And I noticed that my teeth started getting sensitive. It took about 4 or 5 days. And I know that very well. I know that cycle very well. Then I had to I started using my varnish, which is a stronger version of regular toothpaste with nanohydroxyapatite in it. That was helping, but I really had to use a lot of it and frequently. And then it occurred to me that this product, because it was the only thing that I had added, was maybe the culprit. So I measured the pH. It was 2.4. I did reach out to the company, never heard back. Reached out to some other people. They also tested and confirmed that. And then somewhere in the literature, I was able to see that it was 2.4. And 2.4 is just too low. There are a lot of sports drinks that are that low. There's some colas, some sodas that are that low. If you're going to sip it quickly and then chew some xylitol gum and you're done with it, fine. But I was taking my electrolytes twice a day, so I changed brands and I researched everything. Taste is very important to me. It had a different ratio of minerals, but I was able to fix that just by how often I did it. So twice a day, I take my new electrolyte, and that has a pH of 6.4. And to me, that's fine. That is just below neutral. Aim for something over 5.5. That's when, at 5.5, we start, in all the studies, we start seeing dissolution of minerals, calcium from dentin. Obviously, it happens quicker with dentin. But enamel's harder, and then enamel starts at a little bit lower than that. But 5.5 is a good kind of baseline. And remember, a lot of mineral waters are below 5.5. So just analyze or look at what we have on our website. We make recommendations. Even tap water. I measure tap water sometimes in certain areas, and I've measured tap water down to 5.5. And that's not good. So if you're ingesting something every day, make sure you really know what the pH is. And if your teeth are getting sensitive from all these drinks, and a lot of people aren't drinking electrolytes, they're just drinking all these sport drinks and sodas, and even kombucha is on that list. I've measured some kombuchas that are at just below 3. A pH of 3. These are drinks that we sip on, we enjoy, that we have 2, 3, 4 times a day. There is a price to be paid for that. And again, don't brush afterwards, chew your xylitol gum, and know your pH.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
We use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. So a lot of people are going to their dental offices. They're saying, take them all out. It's not being done properly, and they just inhale.